Good morning, YouTube family and friends. I hope you had an awesome week. My week went okay. It wasn't bad at all. Today is Saturday, July 22nd, 2023, and this is my weekly Mounjaro video. I recently just completed week number 31. And I tell you, I worked my butt off this week again, so I'll give it that. I need to start off, though, with correction. If you watch my midweek video about my new blood work test results, I had mentioned that the doctor's office told me my low platelet count was due to platelet clotting from the testing of it. So they said it was pseudo thrombocytopenia. But then later in the week, it was actually, was it Wednesday night or late Wednesday afternoon, the actual results from the peripheral blood smear test posted to my chart with CHI network. And that said the opposite of what the nurse called and told me were the results. The blood smear said that there was no clumping of the platelets or something to that effect. And it said it was and it did confirm that I do have low platelet count. But it was not caused by the pseudo thrombocytopenia. It was not due to the chemicals they use in the blood testing that can sometimes cause the platelets to clot when they're testing the blood. So yep, that was a total opposite of what the nurse had told me. So I called first thing Thursday morning when the doctor's office opened up and asked for clarification for it. And of course it took all day, but at the end of the work day, my primary doctor actually called me back directly. So I didn't get a call back from the nurse. My actual doctor called me, which I thought was nice. And she did verify that the test results that I saw posted, which was the official pathology test results, were correct. She apologized. She said what happens is, she used that dictation device. No, she has that. I know she uses it because every time I have a doctor's appointment, she brings it with her and it records everything that's said and translates it into text notes or notes. And then the nurse will transcribe those notes into my medical records. And then when the test results come back, my doctor will dictate the results, speak the results, and the dictation will put it into written notes for the nurse to input and to contact the patients. And unfortunately, sometimes the dictation doesn't translate correctly or doesn't translate smoothly. And so when the nurse translator updated the record and called me, it stated the opposite. So again, she apologized. So she did verify that I do have low platelet count, and it's from my liver cirrhosis with my enlarged spleen and whatnot. It's not pseudo thrombocytopenia, it's just thrombocytopenia, which is low platelet count due to liver cirrhosis. I guess the bone marrow's fine. She did verify the white blood cells, the red blood cells, all that came back on the test just fine. So my bone marrow should be fine. Yes, the bone marrow makes the platelets, but the liver also has to put a chemical into your blood work, which helps the bone marrow to produce the platelets. Or I'm not sure exactly how they work. It's called thrombospinosia or something like that. It's the chemical that goes in that the liver produces that helps to create more platelets and in between. So that's not, the liver's not producing as much as that chemical, on top of my spleen being enlarged. So the combination of that is what's causing my platelet counts to be low. So unfortunately it's Well, I guess that's the best case scenario, because I didn't want anything to do with my bone marrow, because that could have meant cancer or some sort of blood cancer or some sort. So I'm fine. I'm clear of that. No cancer from that, thankfully. But she said if I'm really uncomfortable and want more diagnosis of it, she can refer me to a hematologist or the blood doctor. But I told her no, because she did state that it's just at a point where it's low, but it's not concerning low yet. They said it went back in March. It was 151, my platelet count. Of course, 151,000. They just said 151. Then when I had my 3-month follow-up in June, it went down to 120, so it dropped significantly. So they retested it after 2 weeks just to see to verify, and it went from 120 down to 117, which isn't a big drop, but it did drop. So she wanted to test it again with a full CDC differential, that's when she tested all the white and blood red cells on top of it and looked to see what the platelet count looked like. That's what the peripheral blood smear test was mainly used for. It was to take a look at the shapes and whatnot, have someone physically look at it directly through a microscope and not have a machine do it. And then that was able to rule out the pseudo thrombocytopenia. So there was no blood clot, there was no platelet clotting or anything. So yeah, so that's where we're at. She said she doesn't get concerned until the platelets get down to 70 count. That's when she starts to panic, she says. So right now I'm just at 112, because that's what the last reading was 112. So, and she said she can refer me to a hematologist, wherever that they're called. But she said at this point where my count's at, and with my liver disease, they would just do the same thing she wants to do, just wait and see and monitor her approach. So I told her I was fine with that. My next 3-month blood work is scheduled for September 6th, so it's only like a month and a half away for my technically 3-month follow-up with all my new blood work again. So we'll just wait and see where it's at there and go from there. So there's really nothing else to do at this time except for continue on my journey to lose this weight and get healthier, and pray that I can reverse this liver disease. As I meant to record a video from the beginning of my non-alcoholic fatty liver disease journey to being now diagnosed with liver cirrhosis. I did not get to that this week. I apologize. I will try to get that video recorded this week, so you guys can have a full understanding of that journey, because there's not a whole lot of videos on YouTube dealing with non-alcoholic fatty liver disease with liver cirrhosis. I tried to find videos and there's just not much. There's some medical videos out there, but overall there's just not many. So not too many people have kept track of their journey on that. So I'm really hoping if I can record a video, it can help some other people out. So, but anyway, that's the update and correction to that. Like I said, I do have low platelet count due to my liver cirrhosis. So it's just on a wait and see and monitor approach, and we'll see where my blood work's at when it comes to September 6th. So, all right, on to this week's results. I weighed myself this morning, and my weight loss is definitely slowing down. I got on the scale. Those 2 teens are being stubborn. They don't want to come for me. I lost just 1 pound this week. I guess it's better than losing 0 or gaining. Last week I was 0. So this week the scale said 220. It's like, oh, if I lean back on my heel, I could get to 219, but I thought that's not accurate. I wanted to make sure I stood up tall, both feet firmly on the scale without leaning forward or backwards, which can mess with the weight on the scale, reading on the scale. So, but it's 220. So I lost 1 pound. So that puts me at a total weight loss of 85 pounds for 31 weeks being on Mounjaro. So I'll take that. That's for the last 4 weeks. So last month I lost a total of 5 pounds, where I was averaging 9 to 10 pounds a month. So yeah, it's definitely slowing down, but I understand. I'm feeling progress. I'm seeing in the mirror. I'm getting a lot of muscle built up. So, and I'm not measuring this week. I want to wait till my final, on my final week of Mounjaro. So at the end of the last week of being on Mounjaro, I'm going to do measurements, and that'll be a month since I took my last measurement. So I really want to measure to help me feel better about the scale not going down that much, but I'm going to wait until next week. As you all know, this is my last week being on Mounjaro. So I'm going to take my last shot today, and then next Saturday will be my final results for 32 full weeks on Mounjaro before I am off of it. The good news is my doctor's office sent in a prescription for Ozempic, because that's something my insurance said they would cover, and they held true to their word. They did approve Ozempic, and I got that prescription this week. So I'm going to start my Ozempic journey next Saturday, and we'll see if it can help me lose the stubborn last 30 pounds. My goal is to be roughly around 190. I can be okay with it being a little higher than that, as long as I'm seeing a lot of muscle built up on my body. So, but that is my main goal, is to get down to 190. I'm 5'11". I could get to 6 foot if I don't slouch, and maybe with this weight off I don't slouch as much. But anyway, that's my goal, is 190. So, but I'm just wanting to get into the 2 teens before my cruise. I was hoping to get below 210 before my cruise in August, beginning of August, but that's not going to happen now. So I'll just be happy if I get into 2 teens. So, but that is the results for this week. I am going to go ahead and take my Mounjaro shot, my last shot. As you can see, it's 5, dosage of 5. So let's do this. If you don't like to see, I'm not going to take my shirt fully off. I'm just going to raise it to take the shot. But as you all know, it has a safety cap. Pull that off. You'll see the needle in there. You'll want to unlock it, and it's set. So, and you want to do the shot in a fat patch, either around your belly button, 2 inches away from your belly button, and your fat of your arm or on your thighs. I like to do the stomach. So I did it on this side last week, so let's do it on this side this week. You want to get your little fat patch here, and you're going to hear 2 clicks. The first click is the needle going in. Second click is the needle retracting. So let's do this. This looks good. Let's do that here. So all right, here we go. There's that second click, the needle retracted, and you can see the needle retracted, and voila, it's done. This was absolutely painless this go around, so that's good. No pain associated with it at all. So that is my final shot of Mounjaro. So we'll see how this week 32 goes. I'm really hoping for the best, and I can see some progress on that scale. But the main thing is put muscle on, lose inches. I want to lose inches here and lose inches around here, and my thighs too. My thighs carry a lot of weight. So, but anyway, that's all I got for you this week, and I will hopefully talk to you later. I said I'll try to get to that liver cirrhosis video, my journey on that here this week. I will try. I can't guarantee it. I know how my week goes sometimes. So, but anyway, that is all I have. You all have a great week, and be safe, be happy, and live your life to the fullest. And I will talk at you later. Goodbye.